years ago, I was very active playing racquetball, and I worked for Merck Pharmaceuticals, so I was in the medical field, and I would be in rooms where they were doing endoscopies and colonoscopies. At that time, it was allowed. But I know I was healthy, playing around. One day, I was playing racquetball with friends of mine, and I felt that I couldn't breathe. At the same time, during that week, my left leg started to swell up, and I couldn't figure out what was happening. And like you look at your leg, and it looks very, it didn't hurt, but it looked swollen, and I couldn't figure out what it was. And I wish the other one would look the same, because I have skinny legs. But anyway, that to me. But playing there, I was running out of breath. Now, being that I also worked in emergency rooms, I went to a friend of mine, a physician friend of mine, and I said, you know what? I think something's going on. My left leg is swollen. And he says, wow, it's hot. He says, have you had it like that? I said, well, I play racquetball. I must have gotten hit by a ball. Okay, and it swelled it up. It got swollen. I said, God. He said, well, what I want you to do is I want you to take a couple of aspirins and go home. If it doesn't come down, elevate it. If it doesn't come down, come back. Come back tomorrow and we'll check it out. So the next day I came back, and we're still swollen. Couldn't figure out. And, I was having a little bit of problems walking and breathing. I said, what's going on? And I felt like I was at Rio Doso. In other words, the atmosphere, the altitude of the oxygen was not there. So I don't know what's going on. So anyway, I went back, and I remember the doctor being there, and Saunders, and he looked at me and he says, you know what? Called a friend of mine. He says, go back there and do a Doppler. So go see, figure out what's going on. So you go out there and take your pants off, and the guy uses a machine and just starts doing that. Remember his name is Joe, and he was doing the procedure. All of a sudden he says, there it is. I said, what is? He said, you got a blood clot. I said, what? He said, you got a blood clot. He says, they're not gonna let you go home. They're gonna keep you here, buddy. They're not letting you go home. I said, that's when you start getting a little scared. We call it scared shitless. But anyway, that's what happened at that point. So you come back, and the guy says, Larry, you can't go home. I said, I gotta go home. I gotta tell my wife. I was in denial, and I was scared. I said, how can it happen to Larry Garcia? How can it happen to me? It can't happen to me, man. It's not gonna happen to me. But he says, you got a blood clot, Larry. You're gonna have to stay. They're gonna give you some medication. You have to stay. So anyway, I went home, came back. I took a little while because my wife, we had to go take my daughter somewhere, and I said, I need to go to the hospital. I need to go into the hospital. There's something wrong. I think I have a blood clot. But anyway, came back, and they were my friends. They had number 7 ready for me. When we walked into the emergency room, they had been waiting for me. You're talking about the nurses and the doctors and everything. I went in there, and within 2-3 minutes, my clothes were off. I was sitting in a bed, and they were taking blood, and they were doing everything possible because of the blood clot. I also had another friend and physician, and he came in and he saw me, and he did everything. So they put upstairs, they put me in a private room, and they started IVs, and they were doing all the tests, and there were CT scans and everything else, and see if I had, I had a blood clot also in my lungs. So I have a pulmonary embolism, or pulmonary emboli, and a deep venous thrombosis. So these words, it's sort of DVT and PE, and anybody that's in the medical fields, those can kill you. Okay, those can kill. But eventually, during the time period that I was there, I stayed there a week, and they were giving me blood thinners and everything else, and see if they could pass it. So the doctor says, you know what, you need to inject yourself with a blood thinner every day in your stomach, Lovenox. And if you can do that, you can go home after about the 3rd, 4th day. Doing that, I couldn't even go to the bathroom. I couldn't move. They were afraid that the embolism, things would move, and I would have a heart attack. In other words, it can clog up in your heart. And that's when you start getting scared. That's when you start saying, I'm not Superman. I'm not Larry Garcia anymore. What's going on? I want to go home. I don't want to play this game anymore. But that's it. You're in. It's your game. And I mean, that's what happened. I started thinking to myself, I said, why didn't I have a colonoscopy? Well, why didn't I do this? So you start thinking all that. So that to me, I said, well, maybe, at that time you're still in denial. So I went home and doctor said, you know what, if you don't get better, and I started losing, the other sign that was starting to come out is that the medication that they gave me, I was going to the bathroom, number 2, and blood was coming up. You could actually see the blood inside the fecal material, not outside. If it's outside, you got hurt. I mean, you got, that's bright red blood, and it's not. It's the deep inside blood. So, doctor told me, he says, you got a deep bleeder. Some things keep making you bleed inside, deep inside. So we're going to do an endoscopy and colonoscopy. So it's interesting how you learn all these words as you go by. So I had to go back, and they prepped me, and got me into doing the endoscopy and colonoscopy. And when we went down, they sort of just, numb you for a little bit, and then you wake up. When I woke up, my wife and the doctor were standing right next to me. And Rolando Longoria is his name, Dr. MD, great guy. So he looks at me and says, Larry, you have a polyp in your ascending colon. Okay, so that means it's the big area from the appendix all. He says, what you need to do is, do you know a colorectal surgeon? Now that right then and there says, oh my God. So what's going to happen? He said, you need to have, and that's another term that I learned, and you learn as you go. He said, you need a right hemicolectomy. And he even made a little joke, it's like a hemi, like a truck, but that's what it's called, right hemicolectomy, which means that they're going to have to do a surgical procedure from your appendix through your transverse colon. And, I can see a polyp that has become cancerous. So what happened is that the polyp was bleeding. The polyp bleeds, it starts sending all this blood, and then you start getting blood clots.
What stage were you?
At that point, you really don't see the stage, but they said it was stage 2. Okay, that was stage 2, which means for those people that are the different layers of penetration. So it's just stage 2 at that point. And so that was a stage 2. Well, make story short, I didn't go home. I was already prepped. And I went into surgery the next day, and they did a right hemicolectomy, removing my appendix and all the way to the transverse colon. Now, if it was on the other side, I would probably have to have a colostomy bag, but I did because it's the ascending, it's the up, and this is a large intestine. But anyway, I went through surgery and the removal of that polyp because they aggressively went a mid incision in the abdominal area, and then I ended up with a whole bunch of clips. But anyway, short story, and it still continues. You get out and you're still Larry Garcia. You don't need this and that, so you start seeing your oncology now, oncologist, hematology oncologist, which means cancer. And then you start seeing your gastric or colorectal surgeon. Another doctor comes into to play there. So now you're adding up, your colonoscopies and everything that goes there. But anyway, one of them was saying you don't need, and this is what really scares you, okay? Because you need chemo. You need to start chemo. Why? I'm Larry, I don't need chemo, they just removed the cancer. He says you need chemo because they're like little babies. I mean, there's a lot of cancer cells and they've spread throughout your body. He says, yeah, but that's the surgeon telling me, Larry, you need chemo so that you can make sure that you took care of all that cancer because it's running around your body. And I said, well, the hematologist says it was stage 2. And he said, well, you're not going to need chemo. Be careful when that is done because you're going to have them make a powwow and talk to them as to see where they are. Because obviously one was wrong, and I'm going to tell you why.
Did you get a second opinion on that?
You can't because they're your doctors at that point. But you can get your second opinion. What you need to do is to get your doctors together. If one doctor's saying one thing, the other doctor's saying this thing, you need to come in together and bring somebody in because it's your body, it's not theirs, okay? Doctors make mistakes. One of these persons made a mistake, Okay, after surgery, you need chemo. That's bottom line. So, okay, so you go and you don't take chemo because you win. You tell the surgeon, the hematology oncologist said, you don't need chemo. So that's what you want to hear. You're making a decision. You really can tell them what you want. You can tell them, I don't want surgery, I don't want chemo, I don't want, okay, they'll do whatever you want. But at that point, I should have said, come together, make a decision, the best for me. Okay, so in other words, I took the road where I didn't want chemo. Once you said you want chemo, okay, then things happen. But at that point, no chemo. Okay, that happened. So I went back and I started seeing my hematology oncologist, and I started seeing my surgeon. All of a sudden, the incisions, they would open up, and there was some problems with surgery. But at that point, but at the same time, it continued to go, and if you ever done that, it took a while for recovery. It took months. It takes actually years to recover from that. But as time progressed, that was there, and I started seeing my hematology oncologist, my surgeon. Well, as we were doing that, a couple of years into that, I started coughing. I said, gee Wilkins, I have a bad cold. This is a dry, hacking cough. And I couldn't figure out what it was. And I would take cough syrup and cough drops and everything. And it was just hurting. All of a sudden, I went to my internist. Here's another guy that comes to him. So remember, you got all these doctors already involved. So now you need an internist. The internist says, you know what, Larry, what I need to do is I need to do an x-ray, chest x-ray on you, because we want to rule out pneumonia, either lower or upper respiratory infection or whatever. But anyway, so I go and take my x-ray and come back. And he says, I need to talk to you. He says, look at this. In the x-ray, you could see a dark black area in the liver and in the lung. But what's happened is that was cancer. It has metastasized now. It traveled from the colon, and that's the first thing it hits, the liver and the lung, because they're all connected in that area. So the question is, do you have a hematology oncologist, and do you have a cancer surgeon? So now you're putting more people in there. So you need a hematology oncologist. So I said, okay, I don't want to go with this guy, so I went with somebody else. So I switched cancer doctors, and it ended up with Dr. Jesus Gomez. Now, great guy, very intelligent.
Yes, Dr. Gomez in Longoria, they were one of our speakers.
Yeah, so Gomez comes in and he says, Larry, we need to start chemo on you. What? He said, you need to start chemo. But before you start chemo, you have to have a portacath. So guess what? Go back to surgery and let the surgeon that actually did the colorectal do the portacath. So you go back and you get a portacath. Qué bonito, right here. Okay, so the portacath is so that they won't mess up your veins and give you the chemo so they won't burn everything. So I got the portacath. Well, 2 days later or whatever, I started chemo. And they gave me 2 chemos IV. One was like an augmentation. It actually works on the chemo cells and it destroys the blood flow. And the other one was chemo, which had a metal into it. It's this platinum type that messes up all your fingers and your neurons and everything else, and it's hard to breathe. And then they also gave me an oral chemo. And he says a lot of breast cancers are connected to colon cancers, so we're going to try you on this to see what we can do. So they started me on the chemo, and the first time they gave me chemo, you think you're strong at that point. That's the strongest part of starting chemo, is your first day of chemo, because you're really, really strong. Okay, now they're going to give you poison to destroy those cells at the same time they're destroying your other cells. So it makes you feel not too good, and then you still go home and continue your oral. So I even forgot, every so many weeks you take a week off and then you come back. There's about 5 or 6 of those, that you go through, and every time you go, you get worse. You get worse. You get worse. Your color starts to change. You start feeling weak. You start going through depression. You really can't even touch metal depending on what they give you.
Is that probably the most difficult part of the experience?
It was one of them. But you'd be surprised what's coming up here. Okay, because that's only not even halfway. Remember, if I would have had a colonoscopy,
Right, I was going to go to that.
if you would, if Larry Garcia, the almighty Superman, would have gone and gotten a colonoscopy at 50 years old, okay, we would have taken.
Any prior history?
No, there was no history. It's just that at that
As
time.
a regular health?
No, there's nothing there. And when they would say, at 50 you need a colonoscopy, me? Why me? And actually, when you think about cancer, nobody wants to think about cancer. Cancer is something that you don't even want to hear. You don't want to see it. It doesn't belong to you. It belongs to somebody else. You are not there for cancer, so you don't want to even hear it. If somebody's smoking, he says it's going to give you cancer, they don't care because they don't care because it hasn't happened. So at that point, you're talking about, okay, going through chemo. So they were checking. You got to go through all these CT scans and CAT scans and all this stuff that they got to look into and give you all these radioisotopes so that they can go in there and do these studies. Okay, they sit you there for an hour and then they put you. At that time, it was done in El Paso, and Dr. Gomez says, well, it's working. It's reducing the cancer, and they could see it was getting smaller, which is the best thing that you can ever see when you're looking at chemo, because the chemo is working and it's breaking down and destroying. Now, that was not the only thing that was needed. Bringing down the chemo doesn't necessarily mean that you're going to take care of it. It's going in there and adding surgery. Okay, so surgery, chemo, radiology, or whatever. That is a lot of ways of treating this cancer. And every time you sit there and put a portacath, the first time I took chemo, it was kind of joking around, and you could see the other people, and you could see yourself, but then every time it was worse and worse and worse. And the worst thing you could do is I need to get up today, and guess what? I start chemo. And then you would rest for a week or whatever, but it's that chemo that would destroy me. And I wasn't myself. And not only that, it destroys your family. It destroys, and then you find these people that don't want to hang around with you anymore because they think that because they hang around with you, they can get cancer themselves. They don't understand that. They're very ignorant people. And a lot of times, there's sometimes everything changes. And you really don't want to go up there and people say, ay, pobrecito, I feel. You don't want that. When you're going through chemo and you're a cancer patient and you see another cancer patient, there's something that you have to be aware of. There's good days and there's bad days. And if you go to somebody taking chemo and you ask them, is it a good day or a bad day? They'll know exactly what you're talking about. And if it's a bad day, leave them alone. Leave them alone. They want their privacy. They just want to get over it. Most of the time we want to go to sleep and just get over it. Maybe if we wake up, it's a dream, but no, it's there. If they say it's a good day, then you can sit there and maybe converse a little bit. Maybe they're hungry a little bit. Maybe they want to eat something. So now I was taken to a liver resection physician in the El Paso area. Okay, and I'm not going to mention names because the same thing can happen, and I'll keep it at that. But it was one of the best in El Paso. So when I went there, he says, I can't see the cancer, and we as surgeons, we need to cut, and we need to see, and the cancer has been disappearing, and we need to go out there and cut it out. So he advised me. He says, look, Larry, he was a friend of mine. Remember, I got all these friend doctors, which was great. Some of them are good, some of them are bad. They're not super and they're not God, and then thank God for the good ones. But anyway, so I go see, remember, look at all these doctors that has been going through. I thank God every day that I had Merck insurance. That's the best in the world. Because if you don't have insurance, you're going to die. I'm going to tell you, you're going to die. Because if you don't have a good insurance, because somebody has to pay for this. And the better insurance that you have, and I'm sorry to say that, the better care you're going to do. So he commented, he says, Larry, you're still young and you got a great insurance. I'm going to give you advice. This is in El Paso. Go to MD Anderson. He says, I do surgeries, liver resections, maybe 1 or 2 a year. They do them every day, and they do hundreds of them. He says, and I would advise you to go to MD Anderson. So, guess what? They made it go to MD Anderson. And if you've ever been at MD Anderson, there's 50,000 people working at the biggest hospital, the best hospital in the world. So you get there and you're overwhelmed. You could put every hospital in El Paso together and they wouldn't even get close to the immense. It's a research hospital. And you go there and you talk to the people and you took it in. And there I picked up another hematology oncologist, and he referred me to the best liver surgeon in the world, Nicholas Vate. This guy is fantastic. Now, if you ever seen a liver, you look at it and it bleeds, so you really need to know what you're talking about. So he decided that he wanted to do surgery on me. Now, we're only talking about the liver. So we went in there and we looked at, and we went through to MD Anderson. And he says, yes, I can do it. He says, I need to cut you straight down again where your surgery is, but then I need to go sideways because we need to open you completely open and get to the liver. And what we're gonna do, we're gonna go in there and we're gonna resect the liver and then take out the cancer part. The question is, well, how are you going to do once you're there? Can you do the lung? He says, no, I only do livers. I said, let's take care of the liver first. So they finished that, and then I was at MD Anderson. They opened me up. And then they had to go, during this first surgery, they did the liver resection, and then they did a reconstructive plastic surgery section because the incision was all messed up, and I think it had gone rippers and stuff like that in there, but it was ugly. So it was a 8-hour operation. Took it out, 8 hours. So after the surgeons finished, the plastic surgeons went in and they did reconstruct. So that was the liver. And then I had to go back, I had to go back in 6 months. I was recovering. I mean, that was the biggest recovery. You talk about losing weight, 50, 60, 70, 80 pounds, different color. You don't recognize me. This is not Larry, when you saw that there. And one guy came up and said, either you got really sick or you got into a really great diet. I said, I was sick. Liver resection, okay? So they take you out to the liver resection and they take you back, and now you're gonna see surgeons that do surgery only in lungs. Okay, so how are you going to take the cancer out of the lung? So he says, okay, so this is one of the best in the world. And I asked him by any chance, you know what, before you open my back, can you do it laparoscopically? He says, let me look into it. So he comes back and says, Larry, we can do a laparoscopic resection. So that was the fastest surgery. And then the laparoscope took a couple of days, and within 4 days, I was allowed to fly, because you got to fly back. I mean, once you come out of the hospital, out of any surgery, you got to go back, and they have to check to you. So that's a lot of time. So that's the whole thing. So you come back and you recover again. So remember, that's years of recovery now. You already have.
You're into this already.
Remember, you had a right heavy colectomy. You had a complete reconstructive surgery. Now you had a liver resection, which is one of the biggest and most sensitive of all. Remember, I got clips in the liver. And then now they turned you upside down and they did a lung resection with clips. So that is what's happening here. And you say, wow, okay. Now the biggest thing is that when you go back every 3 months, you got to fly back to Houston. And you sit there and you've got to do CT scans and all these scans and blood tests and everything that they're doing. When you're doing that, you have to go sit there and wait for the doctor and the results to come back. When the doctor walks in, that's the scary part. You want to shit in your pants. I mean, you're scared because, you know, you want to know, is the cancer gone or not gone? So that's it. You're sitting there and you're going, you know what you're doing. If you're Catholic, you're praying our Hail Marys and Our Fathers. I mean, that's what you're doing. And you're asking him to please help you at that point. So the doctor comes in after those two, and then about a year later, you know, you're going in there, and all of a sudden, it takes a little while. And he comes in and he walks in and he says, Larry, everything looks good, but we can see that in your liver, around the clips, we forgot to get some cancer. Okay, doc, so what does that mean? He said, we have to go open you up again. Completely open you up again. Now remember, they did a reconstructive surgery in your liver, and they put all this material in there to keep it strong. You have a hollow point, and we're not talking about bullets, on this side because they took your colon before. So now I said, well, can't you just do it laparoscopically? No, Larry, we've got to open you up again. So we went back again. Guess what? The next time the third now, this I don't know how many times this is, you go back and there's no plastic surgeon now. So he's always has fellow people. Fellows are doctors that are doing a fellowship to become experts in doing livers. So now we're going to go in there and we're going to open you up again. Okay, and every time they open you up, they cut through the same muscle. So it becomes weaker. So you really can't put muscle together. You're cutting it and cutting it and cutting it. So the bottom of your it becomes weak. You lose sensitivity. You can't feel, and your muscles, they become degenerate, I guess, and there's nothing there. So all of a sudden they go in there and they do another liver resection. And they cut it open again and put some more sections and they put some more clips. So now you're recovering from that.
What kind of health advice would you give him?
Well, most of these young men that you're talking about should be close to their 50s.
Correct.
So either they live alone or they live with a wife or they live with a girlfriend. Take your girlfriend's and wife's advice. She does a pap smear every year. She goes to see the doctor. We don't. I mean, the hardest thing for us, for doctors to tell me is to actually, it's easier to do a rectal exam on a dog than it is on a Hispanic male. Okay, because first of all, nobody wants no digital, nothing up your anus, and then let alone tell everybody that you had a rectal and you go home and actually you don't want to go home because you think you're dishonored or whatever. But that's the way we think. And doctors sometimes don't do that because they'll lose a patient. But that's their job. I mean, they can ask you.
Why do you think men are like that? I know that it's not a cultural thing because I know it crosses culture.
Well, it doesn't really as much. I mean, if you talk to Anglo and
they're all
they will do the rectal exams, and most of the time they're very up on that. As the Hispanic male is.
Okay.
I mean, and you got to be truthful. As the Hispanic male, and my dad just passed away. He was 90 years old, and he needed a rectal for his prostate, and he just wouldn't. He said, "No, man, no, nobody's gonna go there." And if the more educated you are, the better you are to have all these exams. Okay.
I hear you.
I mean, to even have a blood test for specific prostate-specific antigen (PSA). Which is the easiest, okay? Or have a colonoscopy. I mean, that is very hard for them. I mean, most of these men don't do it. We don't do it on our own. We need women. We need our wives or children or a history to go. Well, machismo is very strong, and I mean, and that can kill you in many ways. And we as men don't care about our hair falling until it starts to fall. And if the thing is that you need to listen because we're all human. And we're all made up of cells. And if you understand that, that's what can cause cancer. You need to set aside the machismo a little bit and think about your family. Think about your wives. Think about your children. Think about your grandchildren. Who's going to be there? Why do they have to suffer because you don't want a digital exam or you don't want to go see a doctor because you're macho? And you say to yourself, that's the way I come and that's the way I'm going to leave. I mean, and that has no excuse. That is an excuse not to go. Either because you don't want to go or you're scared or you don't understand it. I think what we need to do is educate. And it's so hard because if you don't want to get educated, then we're going to continue suffering cancer, prostate cancer, colon cancer, you name it. Even los güeros need to protect themselves because you can have skin cancer, which can also kill. I mean, anything where cells are, they can cause cancer.
Right.
I mean, but it doesn't end. And I know whatever happened, you have DVTs and PEs, pulmonary embolisms. You continue to have methicillin-resistant Staph aureus infections, which is skin infections. You have pulmonary embolisms because of the medication that you're taking. It never ends. You don't feel good. I mean, even though you see me and I'm still alive, I still suffer. I mean, you will never be the same. It will never recover.
Do you think if you would have had that colonoscopy, things would have been different?
Damn right. I mean, that colonoscopy the worst thing about having a colonoscopy is the enema. And that you got to take and then you clean yourself, which we all need to clean, and then go in there and take a day off, and by that, if everything is clean, you're gonna do okay. But to suffer, I'm a lucky man. I'm not the norm, okay? I'm not the norm. I'm supposed to be dead.
No, you're not.
When you say stage 4 cancer survivor, that says you are dead. I am not dead. People have to do their part. Men who are Hispanic, Black, White, Asian, we have to do our part. We got to take care of ourselves. We got to go get tested. I know it's hard. I know it's hard sometimes. The biggest thing is I don't have time. I don't really want to go. Because what? Because it's something you don't know. Because it might hurt you. Somebody might stick a needle. No me gustan I don't like needles. Just a little stick, guy. Come on. Things that go up I mean, for a colonoscopy, I mean, most of the time you're under. Sedated. And you feel good. I mean, that is best that you can do. You cannot grab a man and say, ahora vamos. You can't do that. But hopefully, what I can do is pray that every man out there listens and somehow God helps them go get a colonoscopy. Go get yourself tested for blood, because it can happen to you. It can happen to anybody.